Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwa. With 46,617 new cases of COVID and 853 deaths in 24 hours, India has now become the third country in the world to report over 4 lakh coronavirus deaths. India has become the third country in the world after the United States and Brazil to cross yet another grim milestone. On an average, India has seen 1 COVID death every 2 minutes since March 2020. But while cases in India have dipped in the last couple of days, especially in the last 24 hours, cases once again have dipped after a 2-day rise, the Delta variant of coronavirus continues to remain a huge cause of concern, not just here in India, but all over the world. The WHO chief scientist in an interview to NDTV said yesterday that this more transmissible variant is going to be the dominant strain globally. It's already present in nearly 100 countries. Now, while in India so far, the Delta variant hasn't led to yet another surge of cases, remember, it is believed to be behind the second wave. Now, the UK is seeing a worrying spike in COVID-19 infections due to the Delta variant. Australia has curbed new arrivals. The US CDC has warned that Delta will be the dominant strain in the US soon. In Africa, cases are doubling every 3 weeks. So what really one must learn from what is happening all over the world with the Delta variant? Let's focus on UK, because when you look at the UK, 97% of new cases in the UK are of the Delta variant. How is the UK dealing with this, and what are the lessons, most importantly, that India should learn while cases are low? We have Dr. Vikram Talaulikar, Associate Specialist in Reproductive Medicine, joining us from the University College London Hospitals. Thanks very much, Dr. Vikram, for speaking with NDTV. I want to begin by asking you about the situation in the UK. It's a worrying spike in coronavirus cases that you're seeing, and 97% of the new infections are believed to be of the Delta variant.
Yes, thanks for having me on the show, Rishika. So yes, we kind of expected this, that as the restrictions will ease, we will get a spike in cases. And that's what we're seeing now. We're seeing about, say, 27,000 sort of new cases appearing every day. The biggest sort of good news here is that the hospitalization rates, or severe illness rates and deaths, are extremely low. And that's possibly speaking about the vaccination coverage. So although there has been an increase in the number of cases, and as the Delta variant is emerging as the dominant one, the good news is that the hospitalization and death rates are extremely low. So the plan to ease restrictions further is on course right now.
Right. But, what lessons at the moment can India learn from the UK? Because, even if you look at the second wave of infections in India, it came after the UK had passed its peak of the second wave. This was mainly attributed to the Alpha variant to begin with. But now we're dealing with the Delta variant, which is believed to be more transmissible, as much as 60% more transmissible than the Alpha variant.
Yes, I agree. I think in a way the lessons have been learned, and I can see that the testing and the tracing and the vaccination program that's been now sort of put through in India is catching pace. It's going at a good rate. The lessons will still be the same as we learned when the first wave happened. It's about making sure that you have a good testing, tracing system in place. And that's important because every new case that will happen in the area where there are not many cases, you want to isolate those people quickly, get their contacts quarantined so it doesn't spread. Vaccination is the key, really. I mean, all the success here with sort of ease of restrictions and all sort of opening up of the community that's happened is because vaccination has really kept the severe illness and deaths down. So the health system is not yet overwhelmed, and that is the key to sort of beating this virus. It's going to live with us. It's going to be endemic, but it's vaccination, testing, tracing, isolating people in time. That is really the key. You've got to have system ready, because India will have another wave at some point. All countries will have another wave outbreak coming all the time. But you want to make sure that your system is in place, you're testing all the time so that you can identify this virus right when it starts creating an outbreak.
Right. And, let's look at the vaccinations, and we're putting up those figures on our screens at the moment. if you look at the people who have been double vaccinated, the UK, almost 40% of the population has been double vaccinated, over 40% rather. India, compared to that, just 4.2%. Are we therefore, if you look at a comparison between India and the UK, a head-on comparison, are we therefore at a disadvantage when it comes to dealing with the potential onslaught of the Delta variant?
Well, yes, I think it's difficult to compare simply because of the size of populations, the geography, and the way population is scattered in different geographical areas. India has a huge population, so really to get to rates of 40%, 50% vaccination, it's going to be a real difficult challenge, and it will need a real massive effort, even more than what's happening now. So I think all the resources will have to be diverted to getting vaccines manufactured and putting them out at the grassroots level, utilizing every health state machinery which is available. But in the meantime, because the vaccination won't catch up so soon unless the next 1 year or 2 years pass by, you've got to have all the other sort of public health measures in place.
Right.
System of surveillance, system of lockdowns where required, system of tracing. Because, yes, it will take longer for India because of the logistics to catch up with the vaccination drive.
Right. So you're saying that while we catch up, in terms of vaccinating a large number of our people, we need to keep those public health measures in place. But are those, is lifting the coronavirus lockdown therefore a bad idea at this time? Because in India, we've seen varying degrees of relaxations across different parts, knowing very well that the Delta variant is still around.
No, so I wouldn't say lifting all the restrictions, depending on which area you are actually easing the restrictions is not correct. You will have to lift restrictions depending on your economy, depending on how the cases are actually increasing in a particular area. You can't have lockdown forever, but it will be important, therefore, to keep testing and surveillance. So the moment you know that there's a particular city, particular area having outbreak, you lock down temporarily.
Yes.
You go through a strict lockdown in that particular area so that you cut down the spread of virus, while you ease in other areas where you know that the cases are not happening, people have a good vaccination coverage. So it will have to be really the local community and the local leaders will have to take a decision which areas they induce restrictions, which areas are good for easing the restrictions.
All right. Well, Dr. Vikram, thanks so much for joining us with your inputs. I think it's very important for us to understand what's happening with respect to the Delta variant in different parts of the world and how our different economies also, striking the balance between lifting restrictions and dealing with the more transmissible strain. Thanks so much for joining us. But from the UK, let's shift our focus now to what is happening elsewhere in Europe. And what really can India learn in terms of lessons on how other countries are dealing with this dominant variant? Germany expects the Delta variant of COVID-19 to account for more than 50% of active cases and almost 80% of all the new infections this month. So how really is Germany looking at these developments? We have DW correspondent Thomas Sparrow joining us from Berlin. Thanks, Thomas, for being with us. Just how badly is Germany affected by the virus and in particular by the Delta variant at this moment?
Well, if you look at the general coronavirus situation in Germany, especially if you look at infection and death numbers, you'll notice a clear positive trend compared to the beginning of the year. Germans are now enjoying many more freedoms and they can lead a more or less normal life. But, and this is an actually very important but, authorities have warned that citizens must not be complacent. The virus is still there, and in particular now the more infectious Delta variant, which is present in at least 85 countries and also spreading here in Germany. Cases of the Delta variant more than doubled last week in the country, and they are likely to increase further, with authorities warning that it's believed to represent more than 50% of active cases. So all in all, we can say that Germans are enjoying a relatively relaxed summer, but they're aware that the Delta variant could affect things seriously again.
Right, but what are authorities in Germany doing to prevent the spread of the Delta variant? Because it is anticipated that almost 80% of the new infections could be linked to the new strain.
First and foremost, they are asking people not to ignore the variant, not to become complacent. Second, they're also very much looking at the wider picture because various European countries are badly affected by the variant, and as you may know, Europeans are travelling a lot nowadays during the summer holidays. So there's increased risk there. Hence the decision by German authorities to impose stricter restrictions for travellers who come to Germany from Portugal and from Russia. And then there is a debate going on as to whether there should be even more controls for people returning from holidays.
All right. Well, Thomas Sparrow, thanks so much for joining us from Berlin with all those updates. We'll continue to keep a close watch on what's happening with the Delta variant. But we have a very special guest lined up for you on the Friday edition of Coronavirus Facts versus Myths. Now, technology and innovation has really been our tool to fight the COVID pandemic. Researchers at Harvard and MIT have now designed a new face mask that can diagnose COVID-19, and that too within 90 minutes. The researchers have filed for a patent on the technology. They are now hoping to work with companies to further develop these sensors. And one of the research scientists at Harvard University working on this project joins us. Peter Nguyen is with us. Thanks, Peter, for speaking with NDTV. I want to begin by asking you about this new mask that you're developing to detect COVID. Tell us, how does it work?
Yeah, so the face mask is like any other face mask. What we've developed is a sensor that actually fits inside of a face mask. And this sensor has a sample collection area. It sits right in front of your mouth. And while you're breathing and you have the mask on, it absorbs all of the aerosols that are coming out of your lungs in your breath. And after about 15 to 30 minutes, you would press a button on the outside of the mask, and that activates the sensor. The sensor then releases water, and the water basically sweeps everything that's been collected on the inside of the mask into a smaller sensor, and that sensor actually analyzes what you've been exhaling to see if there's any COVID-19 in your breath.
Well, it's absolutely fascinating what technology and innovation can really do. But how accurate is this mask test? Is it as accurate as the gold standard, the RT-PCR?
Yeah, surprisingly it is. So our face mask, unlike the RT-PCR system, doesn't require a laboratory. It's not battery powered, so there's no actual power to it. Everything is actually integrated into the material of the sensor itself. And we were pleasantly surprised that we were able to get results that are on par with the WHO-approved RT-PCR assays for detecting COVID-19.
And at what stage of development are you, we're given to understand that you're seeking patent approval at the moment, but what's your strategy going forward with this product?
Yes, that's a great question. So right now, we've already filed the patents for this. And right now, we are looking to partner with manufacturers. Specifically, we're looking at biomedical device manufacturers. So we're a small academic lab. This is a working academic prototype, but we really right now need to convert this to a product that can be scaled up using mass manufacturing techniques so that we can get this out to everybody that really needs it.
Right. Now, testing is, of course, one of the key tools for containing the spread of COVID. How will this particular product of yours aid that? And what made you think of coming up with a mask as a testing tool?
So what we found was we started developing this a year ago during the first surge in the United States. And what we found when we talked to the doctors was that there was a huge barrier in getting tested and in getting test results back in a timely manner. And what the doctors told us they basically told us, well, if we got the test back faster, we could have made better decisions. And so we need something that can be tested on site that gives you PCR level results. And so by using this face mask, our goal is to rapidly lower the barriers to testing. So in an outbreak situation, you're already going to wear a mask. Why not have the test in the mask already? And when you're done wearing the mask, you press it, you get the test results at the end of that, and then you can just throw away the mask. So our goal is to bring testing down to something that is very low barrier so that a lot of people can have very high frequency testing. Now you can imagine testing being done at least daily, if not multiple times a day, in a very easy manner.
Well, the million-dollar question then is how much will it cost and when will it be made available all over the world?
So our prototype right now, our little academic prototype, all of the material costs in terms of the sensor itself, this doesn't include whatever mask that it's put into. That only costs $5 US. And so for an RT-PCR level test, nucleic acid test that you can take with you anywhere and execute anywhere, that we think that's a really low price point. And by working with manufacturers, we think once we mass produce this, we're going to try to get that price down to only $1 or $2 US. That's our goal right now. And in terms of when we can see this, we are working with manufacturers, and that is kind of the barrier we have right now, is getting this to a form that can be mass produced, as well as going through the necessary regulatory hurdles to get this approved as a diagnostic. And so right now we're looking at, realistically, it would take probably a year to get to that point, moving as quickly as we can.
Well, Peter Nguyen, this indeed looks like game-changing technology. We wish you all the very best. Imagine if you wore a mask that not just protected you from COVID, but also tested you from COVID not once, but several times in the day and gave you a result in just 90 minutes. What a tool it would be to fight the pandemic. Thanks so much for joining us on this edition of Coronavirus Facts versus Myths. Short break here. Up next, we'll answer all your questions on the COVID vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We look to answer any questions that you're Googling about the COVID-19 vaccine. Dr. Suranjit Chatterjee, Senior Consultant Internal Medicine, Indraprastha Apollo Hospitals, joins us. Thanks, Doctor, for being with us. One of the most commonly asked questions is about how effective the COVID-19 vaccines are. We have 3 vaccines currently available in India, hopefully more coming soon. But just how effective are these vaccines?
See, what we have seen in the last couple of months is that people do have infection after vaccinating themselves, but the infection definitely is not serious, and they don't avoid hospitalizations, and we don't have to transfer them to ICU, and it can save your life. So you might get infected. It obviously also reduces the incidence of infection, but you still might get infected, but the severity of the infection and the mortality is definitely less. There's no doubt about that.
Right, but with the new emerging variants, the Delta variant, now the Delta Plus variant, how effective will the vaccines be against them?
See, they would still be effective, but yes, the percentage might reduce a bit as the new variants come in. The percentage might be less. But normally what they say is even if it is effective more than 50 to 60%, it's fine. Most of these vaccines, what they're claiming is even for these variants, they might be effective up to 75, 78%, which is good enough for us for them to protect us. And most of the studies that are coming through are saying that most of the vaccines which are available with us, including the Covishield, the Pfizer, which is available in the US, even the Covaxin for that matter, is all effective against the new variants.
Right. Will we need a booster shot to boost the efficacy of the vaccine?
So that is what the study is undergoing, and I think that at least the Covishield and Covaxin might need booster shots. The study is also going on whether the booster shot should be of a different vaccine, whether it will be more efficacious than others. Obviously, Pfizer and Moderna are claiming that they may not require booster shots. That is what they are claiming as of right now, but it obviously needs to be studied whether it is true or not. But I think for Covishield and Covaxin, we might need booster shots. Only time would tell us.
Well, the other important question is about self-care during COVID. Now, in the event that you do get COVID and hopefully you're vaccinated and you have a mild infection, how can you best take care of yourself?
See, you have to isolate yourself in a well-ventilated room. That's very important. Okay, and you have to see that people are not entering your room. Even your food and everything is served outside your room, and you have to take precautions. People who are serving you food and all that have to themselves take all the precautions, that they are wearing masks and washing their hands and all these things, so that you don't spread the infection outside. Even when you are eating, maybe what you can do is you can have plastic plates, and even the cups and all that could be disposable, which you can dispose in a garbage bag and which you can throw it off later on, so that less number of people are exposed to the infection that you have. It is not an easy thing to do. Let me tell you, I've had home isolation myself for a couple of days. It's a difficult proposition, but it can be done with all the precautions.
Right. And should you, what should you do? What should self-care entail, especially when you have vulnerable people at home, if you have immunocompromised family members or elderly patients at home? What can you do to better protect them?
See, for them, unfortunately, you should not expose yourself to them. That's the most important thing, because if they get exposed to you, especially with the newer variants that are coming in, they are highly transmissible. And if you are sneezing or coughing and all these things, then obviously they would be exposed. So you have to isolate yourself in a different room altogether. Keep that room door closed. Only people are allowed to provide food. Means all these people are allowed to provide food and all that outside. And unfortunately, there are not very many preventive medications available even after exposure. So the best thing as of today is that get yourself vaccinated, get everybody vaccinated, so that even if you have an infection, the vaccinated people have less chance of getting infected. So there is only two things that are happening now. There are only 2 points that we have to really carry home. Get yourself vaccinated at the earliest, and second is follow COVID-appropriate behavior at all times.
Right. And the rules for self-care are the same for vaccinated, partially vaccinated or not vaccinated people?
Absolutely. You should not put your guards down. You should be careful, because you have to follow all the protocols that we have been saying for the last 1.5 years, how to take self-care. Don't let your guards down, because these mutant viruses might be more infectious, might be more transmissible. So nobody knows. Every day the studies are different. So you have to follow the same protocols as we have been recommending for the last 1.5, 2 years.
Well, I think, Dr. Chatterjee, very important two messages that you're sending out. One is that don't let your guard down, and the second most important one, go and get yourself the COVID-19 vaccine. Thanks so much for joining us.